Hey there, memory enthusiasts! Are you ready to dive deep into the fascinating world of memory and cognitive function? Well, you've come to the right place. Welcome to our mind-expanding YouTube channel, where we explore the incredible secrets behind enhancing your memory and sharpening your cognitive abilities. Today, we're going to unveil a game-changing solution that could revolutionize the way you think about memory improvement. So, grab your favorite snack, settle in, and get ready to discover the mind-blowing power of Donepezil. How memory works in the brain. Memory is a complex process that involves the storage, retrieval, and use of information that has been acquired through experience. In the brain, memories are created and stored by the formation of new connections between neurons. This process is called synaptic plasticity, and it is essential for learning and memory. The brain is divided into different regions, and each region is responsible for specific functions. The hippocampus, for example, is a region in the brain that is critical for the formation of new memories. When we experience something new, such as meeting a new person, the information is processed by the hippocampus, and new connections between neurons are formed. Once the memory is formed, it is then stored in different regions of the brain. Short-term memory is stored in the prefrontal cortex, while long-term memory is stored in the temporal lobe. The process of memory consolidation involves the transfer of information from short-term to long-term memory. Memory retrieval is the process of accessing stored information when it is needed. This process involves the activation of specific neural pathways in the brain, which allows us to recall information from the past. What causes memory loss and cognitive decline? Memory loss and cognitive decline can be caused by a variety of factors. Aging is a natural process that can lead to a decline in cognitive function. As we age, the brain undergoes changes that can affect memory, attention, and other cognitive processes. Some medical conditions can also cause memory loss and cognitive decline. Alzheimer's disease is a progressive neurological disorder that is characterized by the loss of neurons in the brain. This loss of neurons leads to a decline in cognitive function, including memory loss. Other medical conditions that can cause memory loss and cognitive decline include Parkinson's disease, Huntington's disease, and multiple sclerosis. These conditions can affect the brain's ability to process and store information, leading to memory loss and other cognitive deficits. Certain medications can also cause memory loss and cognitive decline. Benzodiazepines, for example, are commonly prescribed medications that can cause memory problems, especially in older adults. How Donepezil improves memory and cognitive function. Donepezil is a medication that is used to treat memory loss and cognitive decline in patients with Alzheimer's disease and other forms of dementia. The medication works by increasing the levels of acetylcholine in the brain. Acetylcholine is a neurotransmitter that is involved in the process of memory formation and retrieval. In patients with Alzheimer's disease, there is a decrease in the levels of acetylcholine in the brain. Donepezil works by inhibiting the enzyme that breaks down acetylcholine, thereby increasing the levels of this neurotransmitter in the brain. By increasing the levels of acetylcholine in the brain, Donepezil can improve memory and cognitive function in patients with Alzheimer's disease and other forms of dementia. The medication has been found to be highly effective in improving cognitive function, including memory, attention, and language. The mechanism of action of Donepezil. Donepezil works by inhibiting the enzyme acetylcholinesterase, which is responsible for breaking down acetylcholine in the brain. By inhibiting this enzyme, Donepezil increases the levels of acetylcholine in the brain, which can improve memory and cognitive function. The medication is a reversible inhibitor, which means that it binds to the enzyme temporarily and can be easily removed from the body. This mechanism of action allows for the safe and effective use of Donepezil in patients with Alzheimer's disease and other forms of dementia. Donepezil is available in different strengths, including 5 mg and 10 mg tablets. The medication is usually taken once a day, preferably at bedtime, to reduce the risk of side effects. Dosage and administration of Donepezil. The recommended starting dose of Donepezil is 5 mg once a day. The dosage can be increased to 10 mg once a day after 4 to 6 weeks of treatment. The maximum recommended dose is 10 mg once a day. Donepezil should be taken at the same time each day, preferably at bedtime. The medication can be taken with or without food. It is important to follow the dosage instructions provided by the healthcare provider to ensure the safe and effective use of Donepezil. Side effects of Donepezil. Like all medications, Donepezil can cause side effects. The most common side effects include nausea, diarrhea, vomiting, loss of appetite, and muscle cramps. These side effects are usually mild and go away on their own after a few days of treatment. Other less common side effects include dizziness, headache, insomnia, and hallucinations. These side effects should be reported to the healthcare provider immediately. In rare cases, Donepezil can cause a serious condition called neuroleptic malignant syndrome. This condition is characterized by fever, muscle stiffness, and confusion. If these symptoms occur, the patient should seek medical attention immediately. Precautions and contraindications. Donepezil should be used with caution in patients with liver or kidney disease. The medication is metabolized in the liver and excreted by the kidneys, so patients with impaired liver or kidney function may require a lower dosage of the medication. Donepezil should not be used in patients with a history of allergic reactions to the medication or other medications in the same class. The medication should also be used with caution in patients with a history of seizures, as it can lower the seizure threshold. Alternatives to Donepezil for memory improvement. Donepezil is not the only medication that can be used to improve memory and cognitive function. Other medications in the same class, such as rivastigmine and galantamine, can also be used to treat Alzheimer's disease and other forms of dementia. Non-pharmacological interventions, such as cognitive training and physical exercise, can also be used to improve memory and cognitive function. These interventions have been found to be effective in improving cognitive function in older adults and patients with mild cognitive impairment. Conclusion: is Donepezil right for you? Donepezil is a highly effective medication for treating memory loss and cognitive decline in patients with Alzheimer's disease and other forms of dementia. The medication works by increasing the levels of acetylcholine in the brain, which can improve memory and cognitive function. If you or a loved one is experiencing memory loss and cognitive decline, it is important to talk to a healthcare provider about the available treatment options. Donepezil may be a suitable option for some patients, but it is important to consider the potential side effects and contraindications before starting treatment. Non-pharmacological interventions, such as cognitive training and physical exercise, can also be effective in improving memory and cognitive function. It is important to discuss all treatment options with a healthcare provider to determine the best course of action for each individual patient. Thanks for watching.